I think the biggest challenge is balancing the practice of medicine and the patient's needs with the economic side. You know, I would love, and I typically will spend much more time than other doctors with the patient, counseling patients. A lot of that isn't reimbursed.
Clearly there's a need for, I'd say, not only physicians to be good academically, clinically, but also to know something about the practice management and the insurance and the business aspect of medicine.
Among the many challenges faced by these practices were the business aspects of trying to provide health care in the face of decreasing reimbursement, increasing costs, documentation requirements, difficult contract negotiations, and the pressure to be more productive to maintain adequate revenue. In their own words, these physicians describe the tough decisions and management complexities in the current healthcare environment.
Any physician who is going through the medical college should have some kind of training about the business side of the practice as well. Because see, most of the physicians don't have that kind of sense or that kind of training.
Well, as the years go on, I can honestly say I've been in this for about 14 years as a physician, and the climate certainly has changed. And we've noticed that it's much more imperative that we understand the economic aspect and the practice management aspects. I never dreamed I'd be so much involved with understanding aspects of insurance and how they work, just even how negotiations go about as we are today, and I'm constantly learning. Unfortunately, I think we're going to have to drop some of these insurances, and so be it. When it gets to the point where you're doing cost accounting and you're seeing that you're actually losing money on patients that you cannot negotiate anything with on the insurance aspect, and then I think you need to make a decision here as a business person, and that's not being funded by anyone else. You know, can we continue doing this or not?
As you know that the reimbursement is going down, the cost of the material is going up.
We are trying to keep the number of non-billable items to a low roar here. And I think everybody who's in medicine, particularly primary care, seems to be hit with this a lot.
Big challenge, though, is going to be to keep the expense side down, improve reimbursement. Tremendous challenge to keep up with Medicare, given their threatened pay cuts or minimal pay increases, and especially the Medicare part of having to bill patients and Medicare Part B supplemental insurance.
In response to the many stresses of practice, physicians expressed the need to balance work with their personal life and mentioned the impact that family events, both positive and negative, have had. While members of a practice can become like extended family, in many cases we found that they actually are family, which can create interesting dynamics in the office.
One aspect that we need to work on more in the office is keeping the office here and taking some more time off.
I think my greatest challenge is keeping the office small, working very well, allow people to have access to me. At the same time, I think my biggest challenge is, frankly, in making sure I have a good life outside of medicine. I think it's been real helpful for me to have firm commitments at the end of the day, whether it's a tennis game or singing in choir and for church. If I have a time that I have to leave, it works out really well.
Another big change was when I had my first baby, my first and only baby, and just, you know, nobody had any, you know, well, what do you do about maternity leave? And how do you make those changes in a new practice? And then right after that, I got breast cancer that was life-threatening and went through chemotherapy and radiation. Well, this is a family business. Well, when something like that happens, it doesn't just affect one person, it affects the whole practice. Dr. John's wife, when she got sick and died, again, happens to the whole practice. And then when Dr. John got sick and died. And so all of those are challenges to any practice, but I think with us being a small practice, that is obviously half of us are related to each other. And we've got so many long-term employees here that it really is a family, and it affects the whole business.
What are some of the challenges working together as a family within the practice?
That's a hard question, basically. Because, you know, my office manager is my mother-in-law. You know, I have to be careful, be respectful while asking something to do for me, you know. And that's why I usually do not order things. I just request them.
One of the most important observations during this project was the recognition that small practices are susceptible to a variety of external influences, such as the economics of practice, personal and family events. But these dedicated clinicians use their ingenuity, motivation, and perseverance to prevail.